Hi, my name's Alexa. I'm going to be doing a cardiovascular and a pulmonary exam today. I've already walked in the patient's room. I've provided privacy. I've done hand hygiene, and I've already asked the patient his name and date of birth. So, Lance, I'm going to be doing a chest and thorax exam on you today. So, let's get started.
Right.
First, I'm going to be looking for his configuration of his thoracic cage, and I'm going to be looking for symmetry of his muscles and his shoulders, which are symmetrical. And then I'm going to palpate for any masses or tenderness in his chest. Can you tell me if there's any tenderness?
Mm-mm.
Okay, I'm going to move to your back. Can you sit up a little bit?
No.
Any tenderness?
No tenderness.
Okay, now I'm going to be looking for symmetric expansion. So if I can have you sit up a little bit, or scoot up in your chair a little bit. I'm going to fan my hands out and put my thumbs on his back. And I'm going to squeeze my thumbs a little bit so there's skin in between my thumbs. With my fingers fanned out. I'm going to have you take a deep breath. Okay, and my thumbs moved symmetrically, so we have symmetric expansion. And now I'm going to do tactile firmitus. So I'm going to be placing my hand on his back and his anterior chest and asking him to say 99. And I'll be looking just for that both sides are symmetrical no matter what I feel. So when I touch my hand on your back, say 99.
99, 99, 99, 99, 99, 99.
Okay, I'm going to move to his anterior chest.
99, 99, 99, 99.
And all fields are symmetrical. And there were no abnormalities noted. So now I'm going to listen to his breath sounds. Or I'm going to percuss his chest first, or his posterior lungs first. Then I'm hearing a resonant sound, and that's what you should hear. You shouldn't hear dullness until you move out of the lung fields. And now I'm going to listen to his breath sounds. There are no abnormalities with percussion. And every time my stethoscope touches you, take a deep breath.
Okay.
Through your mouth, please. And his posterior lung sounds were clear bilaterally, and he had unlabored breathing and a regular rate. So now I'm going to listen to your anterior chest. And his anterior chest lung sounds were also clear bilaterally with no signs of wheezing or crackles. So now I'm going to do 3 tests. I'm going to start with whispered pectoraliquy. And so when my stethoscope touches your back, if you could whisper 1, 2, 3 for me.
Okay. 1, 2, 3. Oh, sorry.
I'm going to move to your anterior chest. And during this test, I shouldn't be able to hear him say 1, 2, 3, and I can't, so there's no abnormalities. Next, I'm going to do bronchophony, and I'm going to, when I touch my stethoscope to your back, will you say 99?
99, 99, 99, 99, 99, 99.
I'm going to move to your anterior chest.
99, 99, 99, 99.
And during this test, I shouldn't be able to hear him clearly say 99, and I can't. It's unclear, so there's no abnormalities there. And my last test is egophony, and I'm going to have him say E when I touch my stethoscope to your back, and I shouldn't be able to hear, or I should be able to hear him say E and not an A sound.
E, 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 E.
Lift your hand to your chest.
E, 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 E.
And I can hear him say an E sound, not an A sound, so there's no abnormalities. Next, I'm going to move to the cardiovascular part of my exam, so I'm going to listen to your heart sounds. And when I get to your apical pulse, I'm going to be listening for a full minute. So
Okay.
I'm going to start with the aortic, pulmonic, and tricuspid, and then the mitral valve. Okay, his apical pulse was 61, and his irregular rhythm S1, S2. Now I'm going to listen with the bell, my stethoscope, to the same places. And again, it's regular S1, S2 rhythm, and there's no signs of murmur. And now I'm going to palpate your carotid pulse on both sides. And then I'm going to auscultate your carotid pulse. And I'm listening for bruits. And no bruits were heard. So that is the end of my cardiovascular and thoracic assessment.